Welcome to this episode of the Black Belt Nurse Podcast. I'm Bill Schuler, your host, and if you're new to this channel, this is a podcast where we discuss anything and everything workplace violence related in the healthcare sector. Now, anything in this podcast is not legal advice, not medical advice. You should always follow your local facility's policies and procedures. We do talk about sensitive information, so it might not be appropriate for some younger ears. And with that, does violence in healthcare affect men differently than women? Well, let's dig into that. There's a recent study by Yang and colleagues from 2015 that kind of dug into this a little bit. So the name of the study is Impact of Workplace Violence Among Male Nurses, a Mixed Methods Systematic Review. So in their review, they found about 26 studies that matched their criteria. And what they initially go through is all the effects that they experience from workplace violence. So the effects from workplace violence include physical injury, which can include bruises, contusions, migraines, headaches, hearing loss. There can be fractures, etc. There could be mental health trauma, such as acute psychological stress, which can include anxiety, depression, psychological distress, fear, emotional withdrawal, avoidance behaviors. There could even be chronic psychological damage, including burnout, workplace isolation, decreased levels of self-acceptance, diminished perceptions of decent labor, damaged self-esteem, and undermined confidence. There could also be post-traumatic effects, prolonged psychological distress, emotional numbness, loss of enthusiasm and confidence in caregiving. There could also be impediments to career advancement. There could be decreased work effectiveness, which includes reduced productivity, increased absenteeism, impaired ability or willingness to triage patients, and decreased empathy towards patients. There could also be professional identity crisis, which includes low self-esteem stemming from gender bias, overall dissatisfaction with the nursing profession, cognitive bias that normalizes violence at work. There could also be impaired career stability, which includes intention to leave, willingness to abandon nursing, and decrease job satisfaction. Violence also can contribute to the deterioration of the working environment and social relations. That includes exacerbating conflict in the workplace. That could be increasing tensions among coworkers, a disruption of the work environment, and occurrences of horizontal violence. They also cite that there could be a lack of support system that causes isolation. And that could be a lack of management protection and support, which can lead to feelings of isolation. And there could be family relationship shock. We know that workplace violence permeates into family life at home. There could also be impaired quality of patient care, and that includes a decline in the nursing quality that affects patient safety. There could be reduced attention to patients' needs and care tasks. Workplace violence impairs the ability to effectively monitor and respond to patient needs. And there could be reduced empathy and emotional investment in patients, which includes burnout and trauma leading to reduced empathy and emotional engagement with patients. And lastly, they cite that there could be deficiencies in violence coping mechanisms and potential risks. And this includes violence that is tolerated and underreported. We know that there's a culture of passively accepting workplace violence, meaning that only the serious threats get reported and violence is normalized. And we know that it's a potential safety hazard because if workplace violence is not adequately addressed, it could escalate into more serious incidents. Now, in their discussion, they go over what could be contributing to how males experience workplace violence differently than their female counterparts. And that could include gender stereotypes, including encountering prejudice from patients, family, and coworkers who question their professional competence. And that could be simply because they're a male who happens to be a nurse. They also cite that male nurses could be misinterpreted as threatening or aggressive with patients or families, or even during high stress situations. And if you think about this, some men are huge, are big in stature, or in their demeanor. Just walking into a room could be considered pretty threatening, or how they stand, their body language, how they're built. Just how they appear, without even saying a word, they could be considered threatening or aggressive. Now, of course, there's that, but there's also the actions that they do that could be considered actually threatening or aggressive. People could feel uncomfortable with the male nurse's caregiving style. It might not have a lot of words. It might just be doing tasky things, coming and going and getting the work done without a lot of words, a lot of talking. Who knows? Males and females are different, and that includes in our caregiving style. We know that male nurses are less likely to report workplace violence due to being perceived as weak or incapable of handling the pressure of their role. And that could be due to male nurses feeling pressured by traditional gender role expectations to hide their vulnerability. And then you have and develop PTSD or burnout that further affects the physical health of the male nurse. And it can create this vicious cycle of being vulnerable. And workplace violence poses a risk to the entire healthcare system. We know that it increases turnover rates, it increases inefficiencies, and it increases operational costs. And the productivity losses due to workplace violence are estimated to range from 9.5% to 22.1%. And this is estimated to be between $1,484 to $11,581 per nurse per year in productivity losses from workplace violence. There's always a pervasive violence is part of the job. It's going to be here. There's nothing I can really do about it. So then you're not going to report. And some healthcare institutions lack a well-defined procedure for workplace violence reporting, or the reporting is overly complex. We design it this way. And perhaps there's worries about retaliation from reporting workplace violence, although one study kind of refutes that. Or there's a perception of retaliation if you act as a whistleblower. There also could be lack of positive management response, such as nurses who are not encouraged or supported in reporting workplace violence, they're less likely to do so. Now, the study near the end does highlight some possible long-term positive effects, such as personal growth. You go through a situation, you have time to think about it, you might change some behaviors, you might change some thought patterns, or you could experience post-traumatic growth. However, none of the 26 studies that they looked at reported positive effects. Now, looking at some other studies that have reported differences between males and females regarding workplace violence, I'll go through a few. In one study, they estimated that there was a 18% higher odds of male nurses experiencing physical abuse than female nurses. And that was with a sample size of over 3,000 nurses. They found that males may be located in greater numbers in higher risk areas, such as behavioral health and the emergency department, and they may be called upon to moderate challenging behaviors with patients or relatives, which increases their risk for physical assault. They found that mental health or psychiatric nurses had 3 times higher odds for physical abuse than non-mental health or psychiatric nurses. Some studies also show that female nurses are more likely to experience the verbal violence, while male nurses are more likely to experience the physical violence. Another study showed that males identified that violence is to be expected. And in their study, they also found that all men except one reported violence, and males didn't feel pressured by administration to not report, nor did they fear reprisal when they did report. They found that males could deny emotional trauma or long-term effects, and emotional reactions were not addressed by males. Another study showed that nurses reporting experiencing physical violence were more likely to be male, about less than 34 years of age, worked 9 years or less, worked on a rotation of day and night shifts, and more often on night shift. Another study showed that more males had been exposed to violence than females, and males working in the emergency department were more likely to suffer from physical violence than non-physical violence. Now, putting this into perspective, 11.2% of the nursing workforce is male, and yet some of these studies show that we disproportionately suffer from workplace violence differently, especially from the physical part. Now I'm going to go find my own study. I had to pull it off the shelf. But my own study for my master's degree, there was a ping in mine that was statistically significant of males experienced workplace violence. So in my study, I looked at experiences of caregivers after they had attended a workplace violence education class. And what I found was that there was a relationship between gender and experiencing a violent event after taking the class, with an observation that 68.6% of males reported experiencing violence since training. Males also experience verbally aggressive events at 88.2% more than females, which theirs was 70.2% since taking the class. And males tended to be involved in verbally or physically aggressive situations, with 25.5% experiencing 5 or more events in the previous month. Now I'm interested in your perspective. So I have some questions for you, and feel free to answer in the comments. Are men put in more situations where they're more likely to experience violence? Do men volunteer for potentially violent situations? Do men feel that they can handle potentially violent situations better than females? Do females expect men to handle potentially violent situations? Does healthcare in general expect men to handle workplace violence situations? Is it possible that men sometimes instigate certain situations that escalate into violence? And do we support men differently after a violent encounter than we do women? So leave a comment below. Don't forget to like and subscribe to this channel so you're notified when new episodes drop. I will link the study in the description, and I will see you in the next episode.